Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Mapus. On this episode, I'm joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. Welcome, Vaughn.
Hello, Sheena.
Can you talk a little bit about the vaccine mandate that Biden announced and specifically how it may affect the tribe?
I would love to. Unfortunately, because it was a presidential mandate rather than a law that was, debated and written and passed through Congress. I don't know what the effects are going to be right now, and a lot of people don't. Some people worry that, the mandate may go against, presidential powers and authorities. And so this might be something that just gets caught up in, a long litany of litigation for an extended period of time. So right now, it's not affecting the tribe. I know Incident Command has discussed it, and until we know more, we do know whether or not it is going into practice, we're just going to continue vaccinating as we have been, and taking precautions where we need to.
All right. So how are our case numbers for COVID this week, and are they continuing to rise?
So over the last 7 days, we've had 26 new cases. Some have been at Menominee Tribal Clinic. Some have been tribal members at other sites. About 7% of our COVID tests are positive now, which is up just slightly. However, we've done more testing this last week. We ran 373 tests, which is up over the 200 we did last week. We've had 3 new breakthrough cases in the last 7 days. So we've had a total of 20 breakthrough cases since July, just as an FYI to people. Right now we have 14 active cases. 1 person's been hospitalized. Fortunately, we haven't had any deaths since the 3rd. So that's currently where we are as far as population-wise with the number of new cases. The Department of Health Services has us at about 320 cases per 100,000, which sounds like a crazy amount, unless you compare it to Shawano, which is at 526 cases per 100,000. So we're actually doing fairly okay. Again, it's an effect of having a small population size.
Okay, so I know that we are seeing more and more cases just in the state. So is that creating a shortage with the hospitals?
Sort of. We're kind of, if you look at the trends since last year about this time, we're actually at about the same hospital capacity we were last September. Right now, the hospitals are using about 90% of their beds. Locally, ICU beds, about 93% are in use. Whether or not that's something to get, too worked up over, hospitals typically run at about 80 to 85% capacity. So, there are, fewer beds, but it's not at an alarming rate yet. So there's still a little bit of room. We just suggest you don't get COVID and don't send yourself to the hospital so you don't have to worry about it.
Okay, and I don't know how to pronounce this, so you'll have to correct me. Dr. Slako mentioned RegenCov. What is that, and how does it work?
I'd love to help pronounce that correction, but I can't. So it's a set of monoclonal antibodies. There are 2 of them that have even more difficult names to pronounce. I was just looking at them and I was trying to sound them out earlier, and I was just like, I will just butcher that when we record. I'm just going to say there are 2 sets of monoclonal antibodies. They're given to you at the same time as a mixture. Essentially what a monoclonal antibody is, it's a laboratory-made protein that mimics what your immune system naturally does to fight off harmful pathogens, viruses, bacteria, things like that. And in this case, this set of proteins are meant to fight off COVID. So they're given as a treatment. You can't take it beforehand to keep yourself healthy. So, don't think that, monoclonal antibodies are a replacement for vaccines. And usually they're given through an IV or intravenously. They're for anyone ages 12 and older that have to weigh more than 40 kilograms. And I'm sorry, I don't remember what the conversion is for that right off the top of my head. I think it's like 2.1 pounds or something. Anyway, if you're an adult, you're probably about the right size. They found that this particular cocktail, I'm just going to call it that for lack of a better term, has about an 81% success rate in reducing some of the harmful symptoms of COVID. And, if anyone has any questions, we can definitely put up some of the, postings and papers from the FDA about it and stuff in our show notes. But that's kind of what they are, kind of what they do.
And we have this available for our tribal members, right?
We do. We currently are carrying it at the clinic to help, treat our patients. We're kind of hoping we can prevent hospitalization if people do have a case that is a little more on the severe side. We'd like to keep them out of the hospital as long as possible by getting them, this kind of treatment.
So one, I don't know, what would you call it? A rumor? I don't know. Something that I've seen come up quite a bit on social media is talking about the COVID vaccine affecting menstrual cycles. Is there any truth behind that?
From what the reports I've read out of, the CDC and various universities, I haven't seen any data that indicates that it affects the menstrual cycle yet. We don't obviously have long-term studies, 5-10 years down the road to see if, this will affect it. But currently, with what we do have, it doesn't appear to affect it. So I think that's just another thing circulating through the rumor mill, fortunately.
Okay, and then I know we talked about the Mu variant last week, I think it was. I don't know.
I think so, yeah.
So do you have any more information about that right now?
A little bit. There's not a lot out there right now. For those that didn't catch the last episode where we talked about this, the Mu variant, it's a new variant of COVID that the World Health Organization identified as a variant of interest. It makes up a little less than 0.1% of the COVID cases right now worldwide, so it's not very prevalent at all. However, the prevalence of it has increased in Colombia and Ecuador, where it makes about 39% of the cases in Colombia, and then Ecuador it makes up about 13% of the cases. But they don't have a lot of sequencing available, so they're not sure. They think those numbers might be a little depressed. The World Health, I'm just going to call them the WHO. The WHO describes it as having what they call a constellation of mutations, which, it's just what it sounds like. There are a lot of mutations on the spike protein. They're worried this makes this a little more resistant to vaccine immunity. And so that's why they're trying to watch this. They're also stressing that until they have more research done, they can't confirm or deny that, but they're looking into that right now and running tests on it. So that's currently what we know about Mu. It's almost non-existent here in the U.S. right now. I believe 99.4% of the cases that we have here in the U.S. are all Delta variant. So, it's not on the radar right now. So hopefully we'll be able to increase our vaccination and, our natural immunity and not have to worry about Mu too much down the road.
So, you talked about the vaccine possibly not being effective for that. So the mechanism that they developed for the current vaccine that we have, would that be something that they could develop to stop this variant?
Theoretically, yeah, because of how they developed the Pfizer and Moderna vaccines, they basically just need the mRNA sequence, and they could kind of repurpose the the mRNA, I guess you could call it a payload for the vaccine. And you could make it more specific to Delta and Mu. And I say this like it's easy, but it's a little more complicated than that. But that's essentially what they could do. It might take a little bit longer for them to work up a vaccine that specifically targets like Delta and Mu. But they definitely have the groundwork laid for it at this point.
Okay. Do you have anything else you want to add?
Stay healthy, everyone. Cold and flu season is coming up. I know one of the things that we've talked about is getting a flu shot so you don't have to worry about fighting off the flu and COVID at the same time. So that's always recommended. Other than that, get lots of rest, drink plenty of fluids, wash your hands, and stay healthy.
Thank you, Vaughn.
You bet.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to podcasts on menominee-nsn.gov under the Community tab and keep up to date by following us on Facebook at MITW Podcast. I do weekly updates with Vaughn, and if you have any questions regarding COVID-19, please send those to me via email at podcast@mitw.org.